We are hearing now from Canada's Minister of Foreign Affairs about the situation in Lebanon. Minister Anita Anand released a statement moments ago. In it, she says the respect and protection of civilians are non-negotiable and required under international law. Anand calls on Israel to respect Lebanon's territorial integrity and for Hezbollah to immediately disarm. She condemns Israel's airstrikes on Lebanon and goes on to also condemn Hezbollah's attacks on Israel. Anand also says Canada firmly supports the Lebanese government's efforts to exercise its full state authority and that Lebanon's sovereignty must be respected. As the number of dead in Lebanon tops 300 people, the humanitarian situation is becoming increasingly dire, with warnings that hospitals could run out of supplies in days after the surge of Israeli strikes on the country. Joining me now, we've reached Marwan Issa. He is Oxfam's policy lead in Lebanon, and we've reached him in Beirut. And Marwan, I appreciate you taking the time. Thank you. What are you seeing right now in Beirut?
Thank you so much. The situation right now is very grim in Beirut, especially after yesterday's series of attacks, which alone led to over 300 people killed. And this comes on top of 1,500 people killed since the beginning of March in Lebanon, over 4,000 injured and over 50 healthcare workers. And the situation will not only have short-term impacts, but also long-term ones with the damaging and attacks on vital infrastructure, such as water infrastructure, which Oxfam has observed, and many facilities that we can't reach in southern parts of the country. So even if there's an end to hostilities right now, there will be long-term repercussions for that.
And what kind of humanitarian demand is Oxfam experiencing?
Yeah, so right now we're supporting displaced people impacted by the conflict, and we're distributing multiple types of aid. So right now the humanitarian needs are immense. So our aid includes distributing urgent items such as drinkable water, food, hygiene kits, menstrual health management kits, bedding kits, and also trying to provide water trucking services to shelters hosting displaced populations. But also we're working with marginalized groups that have not been able to access these shelters, such as migrants, refugees, women, and so forth. And currently we've reached over 20,000 unique individuals with such help, but the humanitarian needs remain extremely high.
And are you able to meet that demand?
Unfortunately, we're talking about 1,300,000 people displaced. So the amount of needs are extremely high and all over the country. And there's also a major issue of access due to the rate of attacks across the southern part and also the eastern part of the country. There's a huge issue of access to these areas. So as you know, our priority is staff is first and foremost the staff safety. So there are many areas that we can't really send people to work there at the moment due to the rate of the attacks. So unfortunately, there are many communities right now that are in need of access, but due to the rate of the strikes, we're unable to reach.
And so what options do people being bombarded have if they want to flee?
Yeah, this is another issue that's taking place. Right now, there are at least 8 bridges have been destroyed by Israeli attacks. And the UN recently said that around 150,000 individuals are isolated in the southern parts of the country. So the options here, and there are certain priorities that need to take place. The first and foremost of which is an end to hostilities, an end to the attacks on civilian infrastructure, and to allow humanitarian aid to access all areas in need across the country.
The World Health Organization says that some of Lebanon's hospitals could run out of medical supplies within days, having been depleted by the mass casualties caused by Israeli strikes over the past few days. What happens then?
Yeah, due to the rate of attacks, for example, yesterday there was a huge call for blood donations across the country. There was over 100 locations hit in the span of less than 10 minutes. So we're talking about a major operation that included attacks on very densely populated areas. And so far we have 6 hospitals were closed due to the attacks themselves. And we've recorded almost more than 50 attacks on ambulatory services and health workers. So if this trend continues, Lebanon will have critical issues related to healthcare provision, the provision of vital services such as water delivery. Also, we're talking about issues that will have a number of secondary consequences, such as waste management, food security, and right now, more than one-fifth of the country's agricultural land has been damaged by these attacks. So all of these will have compounding matters of people's access to basic needs.
Marwan, appreciate your time. Thank you. Marwan Issa, Oxfam policy lead in Lebanon.
Thank you so much.